The genetic material defines the creation of molecules inside our body. On the after, the hair is starting to come forward, and this will continue until all the hair comes back. The hair is not going to just automatically come back. It's going to reverse the pattern of the hair loss when you lost it.
Dr. Ray Nettles is redefining hair and hormone health with data-driven precision, transforming patients through custom biochemical insights. Get ready for a conversation about real results and lasting health.
Good morning, Dr. Nettles, and happy Monday.
Good morning, Tracy. Happy Monday with you.
All right, very good. So today we're going to talk about a very important topic, which is androgenetic alopecia. So last time we spoke about autoimmune areata alopecia. So this is a different kind of alopecia, which is androgenetic alopecia. So that's what we're going to talk about today.
Okay, great. Can you remind me again what the word alopecia meant?
It's Latin for hair loss.
Alopecia is Latin for hair loss. Okay, great. So alopecia by itself is just basically describing hair loss. And then we need a description of the type of hair loss. Is that right?
That is right.
Okay, great. So you mentioned that we've already gone over the autoimmune hair loss. So today we're going to go over and you called it androgenetic.
Yes, sometimes called male pattern baldness or female pattern hair loss are the other names that people call it, or just genetic hair loss.
Androgenetic, and let's keep going, or just genetic by itself, or
male pattern or female pattern hair loss.
Male or female pattern.
Yeah.
Okay. Male or female pattern, androgenetic, and sometimes just genetic. Okay, great. So do you want to describe androgen or the genetic part?
Well, you're the doctor, so maybe you should tell us that you're the one who worked
it
out.
Fun. Okay. Okay, they're both fun. So we're going to talk about, let's see if this works. Okay, great. Androgenetic. The first thing we're going to do is decide what the word androgen means. So why don't we just stop it here? Androgen. So androgen is the male hormone. Okay? This equals male hormone.
Is that testosterone?
Good. There you go, right? Testosterone. Okay. So androgen is describing male hormone and the testosterone molecule. So that's why it's called androgen. And I think most people, Tracy, they've heard of DHT.
Right.
Do you think
but
they've
that's
heard
different
of
though, right? They have.
Well, we're going to get there. That's a good question. So DHT people have heard of. So androgenetic alopecia, androgen, genetic. Now, what does androgen mean? Male hormone, testosterone. What's the other testosterone that is commonly associated with hair loss? It's DH testosterone, DHT. Right. Okay? And we won't get into exactly what DHT is today, I don't think. Or we can. Let me briefly just go over it since everybody's watching. Okay, great. So testosterone is testosterone, and then DH is what? Di, meaning two, hydro, meaning hydrogen ions. So DHT is exactly P with two H's. That's it. And we know the H's have a positive charge, so we already theoretically understand that charges have something to do with creating signals, and these are all found inside our bloodstream. Okay, so molecules are found inside our bloodstream, and now we know it might have a positive signal or it could have a negative signal. So signals are coming from the molecules in our bloodstream. Okay, great. So androgenetic is the hair loss. Androgen, we feel comfortable with that word. Now let's jump over to genetic, right, Tracy? Let's take androgen away. And now let's focus on genetic. So androgen is the hormone, and genetic is telling us it's a gene, right, inside our DNA. Okay, great. This is our DNA. One piece comes from mom. And where does the other piece come from, Tracy? Mars? No.
Dad.
Comes from dad. Okay. So we don't cherry pick parents. Our parents supposedly fall in love and we pop right out. We get half of our DNA from our mom and half of our DNA from our dad. DNA is composed of genetic material. Since the spawn of the foundation of the world, we've had genetic defects that have continued to increase within our population. And we're at the point today where 80% of men have genetic defects causing hair loss. 40% of women have genetic defects causing hair loss. Okay. The genes, the genetic material, define the creation of molecules inside our body, such as enzymes. So we've heard that DHT is the cause of hair loss, but not exactly, okay? So the gene that causes hair loss does not cause DHT. It does not cause testosterone to turn into DHT. The gene codes for an enzyme. So there's a gene in the body, the gene, and it's going to be the recipe coding for the enzyme. Okay. And I think a lot of the listeners probably can tell you the enzyme that is affected. Most people know it's the 5-alpha reductase enzyme. Okay. Reductase enzyme reduces the molecule. Reducing has to do with hydrogen ions. So you're either going to put on hydrogens or take off hydrogens, turning it into hydrogen gas. And that's how testosterone turns into DHT. There's a defect in the DNA causing a defective enzyme that causes too many hydrogens to be placed on the testosterone molecule. When we run the blood work, it's obvious for us to see there's too many DHT molecules, not enough of the free T molecules. And that pretty much sums up the cause of hair loss. And then we have to think about men for a second, okay? Because the last 10 or 20 years, men have tried to work on this reductase enzyme with molecules, finasteride and dutasteride, and they cause side effects. The side effects happen because of repairing the enzyme. Let me say that again. The side effect comes because of repairing the enzyme. Hold on, doc. If you repair the enzyme, that should repair the side effects and I should have normalcy. This is where the trick comes in, Tracy, because the molecules testosterone and estrogen, even though they sound like one would be a Ford Pinto and the other would be a Mac laptop, they're not. They're very similar. They're as similar as the potato is to the sweet potato, okay? So hold on, Doc. You're telling me that testosterone is similar to estrogen, It's almost as similar as testosterone is to dihydrotestosterone. Let me show you. So testosterone is not necessarily the problem. Men and women both have testosterone. Okay. But enzymes in the cell can turn testosterone into dihydrotestosterone. Enzymes in the body can also turn testosterone into CH4 testosterone. Okay. So the difference from a molecular standpoint, Tracy, DHT has what? 2 hydrogen ions. And I'm going to tell you that if you take testosterone and take out CH4, you're going to end up with estrogen. This is something that we have discovered, and this changed the world because H2 is hydrogen gas. What is CH4, Tracy?
I don't know.
Methane gas. But both of these are commonly found in the GI system. So our body takes naturally occurring enzymes and atoms to move around and change molecules in order to create signals to DNA inside other cells. So this is happening inside a cell in the body, and then the bloodstream is taking the molecules androgen and estrogen and testosterone, circulating throughout the body, creating signals to cells in other places. What cells are we worried about? How about hair cells? So the hair cell, Tracy, is listening to the signal that comes from the bloodstream, which comes from the molecules inside the body, which are made from atoms which have charges.
Okay.
So the hair follicle has DNA listening to the bloodstream, which has either DHT or free T. So free T is the good version and DHT is the one you want less of. So if the free T is higher than the DHT in the bloodstream, this will create a positive signal to the DNA inside the hair cell, causing the hair cell to grow. If the DHT is found in a higher amount in the bloodstream, that signal will be negative to the hair follicle, causing the hair follicles to shrink.
So we need some DHT, right? It's just an ideal ratio.
So we work on regulating enzymes in the body, and we use the amount needed based on the blood work, based on what we find in the bloodstream. We determine the amounts of molecules needed to reorganize and recalibrate the molecules. So for example, I'll just draw something, correct? So imagine total testosterone was found in one place. The free T is found over here based on the enzyme. You're either going to make the DHT or the free T. Anything extra is going to make the estrogen. So I like to think about this as, think of this as flour and you're a baker. What do you mean, Doc? You're a baker and this is flour and you're getting orders. You're getting orders from bread, pizza, and cookies. Bread, pizza, and cookies are all made from the flour. But if I don't get as many orders for the cookies, I'm going to have more flour. With more
Right.
flour, I can make bread or the cookies. So we have
Yeah.
to determine the hormone axis inside the body, and then there's an influence to the nutrients that come in from our nutrition, and the HDL molecule determines how much of the testosterone flour is inside the body. So there's a lot of things that we're looking at, but the good thing is, Tracy, we've been doing this for over 20 years, so we have an algorithm now. So we have an algorithm that we just push in numbers, and it tells us exactly what to do, and we've been doing that for the last 20 years. Okay, great.
Is it possible to tell whether I have androgenetic alopecia by looking on the outside, or can I only tell from the blood tests?
Okay, good question. Where do these questions come from? All these smart people online. So
Yes.
androgenetic alopecia. How do we determine it, doc? I don't want to go do blood work if I don't need it. What if I don't need blood work, doctor? It's possible, maybe you don't. So first thing we do, Tracy, we look at the pictures for the pattern. We did the same thing with the alopecia areata. We first look at the pattern. Now remember, with the areata, the pattern was empty follicles, because in that type of hair loss, the immune system causes the hair follicle to be ejected. In the androgenetic hair loss, the hair is not ejected. In fact, when we've been examining it during our research under the microscope, we would find the follicle, which is buried under the scalp, could have 5 small strands of miniaturized hairs. So the key takeaway here, Tracy, is miniaturization. Okay, miniaturization. So it wouldn't be empty follicles, they would be thin hairs in the predisposed 5 zones of hair loss. And maybe we'll do a podcast or video on the 5 zones of predisposed hair loss and genetic hair loss. We can also go to the website, and I can show you some of the images of miniaturization in the 5 zones. Would you like that?
That would be great.
Great. Here we are. We're at the website, and you can go in here and see all the befores and afters, and we'll find a couple of cases. So a lot of these are combinations. Last week we went over the alopecia areata, the immune-mediated hair loss, and the cases sometimes have a combination. So I'll find you a good case here. Okay, right here is a very good case right here. Okay. All right. So in the genetic alopecia, it's a slow chronic hair loss. It can start we have clients, we have men and women as young as 16 years old getting started on the program. So the genetic hair loss is going to be a slow process of hair thinning, and receding and thinning, and receding and thinning. Miniaturization. So the hair is going to continue to go backwards. And you'll see here on the after, the hair is starting to come forward, and this will continue until all the hair comes back. Okay? So the genetic zone 5, so in the back, this is zone 5. It starts out as something small, and you try to cover it up. You comb it over, and you do your best, and you pray, and you hope it doesn't get bigger until it opens up to be this large. And then, of course, this is over the course of 18 months, 24 months, and now it's going to continue to get smaller and smaller until all he has left is this piece here, probably another 12 months, and that will be filled in as well. Okay.
Great. Yeah, I think that's what it's important for people to understand, is that when the hair grows back, it doesn't grow like grass. It just reverses. It grows back the opposite of the way that you lost it.
Good point to make, Tracy. You're right. So people think we're chia pets. You think hair just fell out and you want it all to come back, but we're not chia pets. and the hair is not going to just automatically come back. It's going to reverse the pattern of the hair loss when you lost it. So you'll see here, this gentleman here. Look how nice this outcome is for this patient, right? All of this in the front was going back for him. All this was going backward. All this was not very thick. It was opened up in the back. And now look, all of this came up, this came forward, and this circled around in the back, okay? So you have 5 predisposed zones. This would be zone 2, zone 3, zone 4, zone 5, and zone 1 would be the other temple, okay? Those are the predisposed genetic hair loss zones, whereas the autoimmune hair loss can be where? Anywhere on top of your head. And I think next week we'll go over the cases, my own cases of hair loss. We'll go over androgenetic as well as the areata, the immune mediated, and we'll have the photos. That'll be a great video when you guys come back next time.
Oh, yeah, that would be great to see. But yeah, I know we often have people complaining because a lot of guys do not see the back of their head. So they don't notice when zone 5 starts to thin. They don't notice until really at zones 1 through 3 start to recede. And then that's when they notice. And they don't realize that they've lost a lot of hair in the back. And then when the back fills in first, they don't see that either. And so they don't think their hair is regrowing, even though it is. And they don't really care about the back because they don't see it. They care about the front because that's what they see in the mirror all the time.
Yep, very good. So this case here, receding backwards, right? Receding backwards on both temples, zone 1, zone 2, zone 3, zone 4 is opening up. Zone 4 is opening up in the middle, and you can see zone 5 is opening up in the back.
Yeah.
And this is just a couple of years later, 18 months later, right? Moves forward, comes up, circles around. You see, what a great case.
Yeah.
I'm very happy. And he came from Australia with his brother, and both of them grew their hair. Very happy. We have clients, Tracy, now every state in the United States. We just had someone last week fly in from Hawaii. And then we've got 6 continents. Only 1 continent without a hair grower down here.
Where's that, Antarctica?
That's it. If we get a scientist to go back there with a little bit of hair growing medicine, we'll grow his hair in Antarctica. All right, last case. First, I remember this case like the back of my hand. I had learned how to do hair transplants and follicular units, hair transplants, and boy, we were getting excited. This was 25 years ago. We were doing a bunch of cases. I had this young man come into my office. He said, "Doc, I heard you know how to do the follicular unit hair transplants, and I'd like to do the procedure." And boy, I looked at this case over here, and I realized this was not going to be possible. This was not going to be possible. This person was losing so much hair in all of the zones. So we have about 100,000 hairs on our head. If he loses, 60,000, right? You lose 60,000, I can only transplant about maybe 8,000. So I'm going to need 8,000 hairs to cover 60,000. This is never going to work. This would never work. So I said to him, I said, "Greg, how about I do this?" I said, "You try the program, the capsule and the topical, you try it for 1 year. If we don't get evidence that it's working, I'll give you the credit towards the hair transplant, which is very expensive." And he said, "All right, that's a deal. I'll give you 12 months. This was at 14 months, he'd grown a full head of hair. And then this is him 9 years later. So the goal is to grow it and then maintain your hair for the rest of your life. Okay, we never could have done this with a hair transplant. This is impossible. So it's always best to naturally regrow your own hair by repairing the common genetic defects with common regulators to make commonly formed molecules in the body, such as hydrogen gas and methane gas. Does that make sense, Tracy?
It does. But I want to go back to something you said. If somebody is thinning in all 5 zones, you're saying that there's not enough donor hair to give you enough follicles to transplant to fill up that area. Is that what you're saying?
So I didn't say it. Mathematics will tell us, right? Let's just do it together. About
Yeah,
100,000. Some people say 150. Doesn't matter. Call it 100,000 on the whole head. If you're going
right,
to lose half of the hair of your head, that's half. Call it 50,000. And
right.
then just think you're going to deplete the other zone to then take from Peter to pay Paul. So your 50,000 zone is going to go down to about 42,000 to then take another zone of 50,000, put 8,000. It's never going to work. So no, the transplants are best for small cases, very small cases. So a lot of our cases, after I stop their hair from falling out, regrow as much as I can. If and then after that point, if they have a little area that for whatever reason, a scarred area, or they wanted a little bit lower hairline after we found their potential, yes, then you could. What usually happens, Tracy, we see people that have done hair transplants in their 20s and 30s before
Right.
the potential of their hairline had been discovered. They end up with hair down in the middle of their forehead, and they want me to regrow their natural hair down to the mistake hairline that a surgeon decided would be good. We have so many angles and curves to our hairline, it is next to impossible to redraw that. So the best would be to discover your natural hairline and then from that point decide what to do with it. And we've had a couple of cases where we've been able to do that. I'll show you one here. This was my last hair transplant case. I remember it like the back of my hand. He's such a super sweet guy. And he came in
Keep
and
going.
someone had already done a hair transplant for him and they moved the hairline too low. And he said, "What
That
can you do
one
about
on
it,
the right.
Doc?
There you go.
What can you do about it?" I said, "I'll tell you what I'm going to do." And this was, what, 15 years ago? Over 15 years ago. All right.
2013.
So
When's
he
that?
came in and his
13 years
hairline,
ago.
they put his hairline down here, and his natural hair was going to stop up here. So we had about a half an inch worth of hair to do something with right here. So I said, let me grow it back to your natural line, and then I'm going to just put a little thread all through there. And look at that result. Turned out great.
It's beautiful.
All right, last transplant right there. Okay, so
Very
that
good.
is the androgenetic alopecia. We learned a lot about androgens, which is a type of testosterone molecule. We learned about genetics, DNA, and genes. We learned about
Yep.
signals coming from molecules in our bloodstream. Boy, we've gone over a lot.
I have one more question.
All right,
So,
one more.
is it possible for me to know that I have it without blood work, or do I need to have the blood work to confirm?
So the truth, so that question, do I need to have the blood work to determine that I have this type of hair loss? The answer is no. You don't need the blood work to determine that you have androgenetic alopecia. However,
Okay.
you do need blood work if you're going to treat this type of hair loss. See, you don't need blood work to
Right.
determine if you have this type of hair loss. You do need blood work if you're going to treat this type of hair loss. Why? We have to determine the entire hormone axis. I need to decide if molecules need to go left, right, up, or down. I need to decide if we're going to add hydrogens, take off hydrogens, use methane gas, take away methane gas. Okay?
So then, really, from what you're saying, it seems like anyone who tries to treat it without doing that is almost negligent because they potentially knowingly causing side effects.
Absolutely, Tracy. It should be borderline negligent for a physician, a medical professional, to treat hair loss without determining the metabolic or the biomolecular cause. because in 20% of men that have high estrogen, you are going to turn the DHT molecule into estrogen and cause the side effects of anxiety, racing thoughts, gynecomastia. The basic common effects that estrogen, a woman's hormone in a man's body, would cause is what's commonly caused. They're called side effects, but those are known effects if you
Right.
determine the blood work first.
And that's what the most men are afraid of, right? Is the sexual side effects that they get.
And you're right, Tracy. They're scared of the sexual side effects, and there should be zero side effects if you get your blood work done first.
Thank you so much, Doctor. And everyone, if you like this content, you like this video, make sure to like and subscribe so that you can get notified when the next episode comes.